Welcome back, everyone. We are absolutely thrilled to have you here for another explainer. Today, we're tackling an incredibly fascinating yet deeply important topic. We are unpacking the biology, the vectors, and the mechanics of dengue. Okay, let's dive into this and look at exactly how this virus operates out in the real world and what it actually does inside the human body.
So here's our roadmap for today. We'll trace this journey starting from the massive global scale of the disease down to the microscopic villains responsible for it, how temperature supercharges them, and finally the severe effects this virus has on our bodies.
Section 1. Global Impact of Dengue, the Hyperendemic Threat.
You know, it's really easy to think of tropical diseases as distant problems, right? Just numbers on a page or something that happens to someone else. But dengue? Dengue doesn't care about borders. It doesn't care about your wealth or your status. A truly tragic example of this was back in October 2012 when the legendary Bollywood director Yash Chopra passed away from dengue fever. I mean, he was at the absolute height of his career, prepping for a major film release. His passing was a massive shock to the world, and a stark reminder that this virus can strike absolutely anyone, anywhere, no matter how insulated they might feel.
And when we zoom out to look at the global data, the numbers are just staggering. In recent data, we're talking about 6.5 million reported cases worldwide. But that burden, it is definitely not shared equally. Asia bears an overwhelming 70% of the global dengue burden. In fact, in parts of Southeast Asia, dengue is considered hyperendemic. That means multiple strains of the virus are just constantly circulating at incredibly high levels, causing massive outbreaks in both urban and rural areas.
Moving on to Section 2, Main Vectors of Dengue. Meet the adversaries.
First off, let's talk about the virus itself. Dengue isn't just one single uniform virus. It actually comes in 4 distinct flavors, or serotypes, known as DEN1, DEN2, DEN3, and DEN4. Now here is the really tricky part about dengue biology. If you get infected by, let's say, DEN1, you only develop lifelong immunity to that specific type. You are still completely vulnerable to types 2, 3, and 4. And actually, as we'll see a bit later, getting infected a second time with a different serotype is what leads to the absolute most dangerous forms of the disease.
And this brilliantly illustrates the personalities of our 2 main mosquito villains. First, we have Aedes aegypti. Think of this mosquito like someone visiting a chaat chowpatty, a busy, chaotic street food market. They are nervous snackers. They bite one person, get scared off, fly to the next person, take a little sip, and so on. Because it takes multiple bites on multiple people for them to get full, they spread the virus rapidly through a whole household, creating case clusters. On the flip side, we have Aedes albopictus. This mosquito treats a human like an all-you-can-eat buffet. It's a highly aggressive eater. It lands on one person and literally will not leave until it is totally full, even if you try to swat it away. Since it gets all its blood from one source, it tends to cause isolated cases.
Section 3. Temperature and Infection, the Incubation Engine.
To really grasp how this spreads, we have to understand a crucial piece of medical jargon, the extrinsic incubation period, or EIP. Usually, when we talk about incubation, we mean the time it takes for a human to feel sick, right? But EIP is completely about the mosquito. It's the exact duration it takes for a mosquito to become fully infectious to others after it has bitten a sick human. The virus literally has to travel through the mosquito's gut and eventually make its way into its salivary glands before that mosquito can pass it on.
Let's move on and see how this builds on a timeline. So on day 1, an uninfected mosquito bites a human who is sick with dengue. Over the next week, days 2 through 7, the virus is furiously multiplying inside the mosquito's body, but the mosquito can't spread the disease yet. Finally, around days 8 to 10, the virus reaches the mosquito's saliva. And from this moment forward, that mosquito is a lifelong vector. Every single time it bites someone for the rest of its life, it's transmitting dengue.
But here is where our environment plays a truly terrifying role. This mosquito's timeline is heavily dependent on ambient temperature. Studies have shown that a mere 2 degrees Celsius rise in temperature drastically shortens this extrinsic incubation period. Think about that. If the mosquito becomes infectious in 7 days instead of 10, it essentially gains 3 extra days in its lifespan to just fly around infecting people. A tiny bump in heat literally turns these bugs into faster, deadlier, and hyper-efficient infection machines.
Section 4. Types of dengue fever, the attack on the body.
For a lot of people, a dengue infection shows up as classical dengue, which has totally earned the horrifying nickname breakbone fever. And believe me, it lives up to the name. Patients deal with extreme muscle pain, intense joint pain, super high fevers, and this very specific agonizing pain located directly behind the eyes, called retroorbital pain. Patients say it feels like your bones are literally breaking under the strain of the virus.
Now, while breakbone fever is absolutely excruciating, it is generally self-limiting. The patient rests, stays hydrated, and eventually recovers. But in some cases, the situation deteriorates incredibly fast. So what exactly is happening? Why does a standard dengue infection suddenly pivot and become deadly?
So, the crucial point is that the true danger lies in something called plasma leakage. You see, the dengue virus specifically attacks and damages this microscopic layer lining our blood vessels, called the endothelial glycocalyx. When that layer is compromised, the blood vessels become highly permeable. Basically, they become like leaky pipes. The watery fluid part of the blood, the plasma, starts seeping out of the vessels and just pooling directly into surrounding body cavities, like the lungs or the abdomen.
Now, what's really interesting about this data is that we can actually track that invisible internal leakage using standard blood tests. When a patient goes from classical dengue to severe dengue, also known as dengue hemorrhagic fever, we see some very distinct changes. Platelets, which are the cells that help your blood clot, plummet from under 1.5 log to dangerously low levels under 1 log. But look closely at the hematocrit value. Hematocrit measures the concentration of red blood cells. Because all that watery plasma is leaking out of the vessels, the blood that's left behind gets incredibly thick and sludgy with red blood cells, causing a 20% or more spike in hematocrit. This spike, along with physical evidence of fluid in the chest or abdomen, is the ultimate red flag for plasma leakage.
Section 5. Severe symptoms and signs, spotting the danger.
To check for this kind of capillary damage, doctors use a surprisingly simple, non-invasive method called the tourniquet test. Here's exactly how it works. You inflate a standard blood pressure cuff to a midway point and hold that pressure for exactly 5 minutes. Then you release it and look at the inner elbow. If the blood vessels are damaged by dengue, that pressure will cause tiny microhemorrhages right under the skin, which we call petechia. If you can count 20 or more of these tiny red spots in just a 1 square inch area, that test is definitively positive for severe dengue risk.
Now, if this plasma leakage continues unchecked, the patient loses so much blood volume that they enter dengue shock syndrome, or DSS. We have to be aware of these critical, final warning signs. You'll see the pulse pressure drop to 20 or below. You'll notice a delayed capillary refill, meaning if you pinch the patient's fingertips so it turns white, it's going to take a dangerously long time to turn pink again because blood flow is so poor. Their hands and feet will become freezing cold to the touch, and they'll experience severe hypotension, which is crashing blood pressure. Spotting these signs immediately is absolutely critical for emergency, life-saving intervention.
We've covered a massive amount of ground today, right? From the microscopic damage inside our blood vessels, all the way to swarms of hyper-efficient vectors out in the world. But I want to leave you with a final thought to ponder. Knowing just how deeply adaptable this virus is, and knowing that a mere 2-degree rise in temperature supercharges these aggressive buffet-eating mosquitoes, as global temperatures continue to tick up year after year, are our cities truly prepared for the inevitable expansion of dengue? It's a major intersection of climate, biology, and public health that we absolutely must start taking very seriously. Thanks so much for joining me for this explainer, and as always, keep learning.